Good evening, all. I am Tanisha Singh, head of the broadcast committee at Inflame Medical Magazine, a student led magazine. I extend my very warm welcome to Dr. Sarika Verma on this podcast, and thank you, ma'am, for sparing time out of your busy schedule to be with us. It is my privilege to introduce Dr. Sarika Verma to our august audience. Ma'am is a renowned ENT surgeon and allergy specialist based in Gurugram, Haryana. She runs a chain of clinics called Allergy Doc with 10 centers in 5 cities. She is presently the secretary of Indian Medical Association Gurugram and is involved in multiple social, political, and environmental causes. So, doctors today are the frontline workers who are dedicatedly fighting to conquer this deadly virus. Vaccination is a big weapon against fighting COVID 19. Even the government of India started a campaign for vaccination, yet it is not being done at the pace it should be. One of the main reasons for this is the myths surrounding the vaccination. Today, Dr. Sarika would be busting the myths which are very prevalent these days. So, ma'am, my first question to you is when should a patient visit the hospital? The first day they experience the symptoms of COVID 19 or after 4 to 5 days?
See, ideally, if you have got exposed to a known patient and you know that this person was, you come to know that someone was positive, then you must isolate yourself from that day itself. The moment your friend tells you that boss मैं तो positive आ गया हूँ तो तुम देख लो, so that is the day when you isolate yourself, keep yourself in the room and try not to expose even your family members. That is the first and foremost. And everybody in your family must isolate. Nobody should step out. When you start developing symptoms, suppose on day 2 or day 3 you find sore throat or fever, then you have to be careful that you know that your symptoms are there. I would advise that you get your test done. Instead of visiting a hospital, you get a RT-PCR done immediately the moment you get symptoms or within the 48 hours, because a lot of time patients say कि नहीं मैंने तो ठंडा पानी पी लिया था मुझे तो viral है. If that is the case, very good. You just start paracetamol. I would advise, please do not go to a doctor's chamber because then you are infecting that doctor, their staff, and anybody else on the way that you meet. So it is better that you do a home isolate, strictly self isolate, and do a online consultation either with the ENT or your general physician. And if your symptoms become high, and your symptoms usually include fever, sore throat, cough, headache, severe body aches, it may or may not. So a lot of time patient says, no, I have fever, but my smell is fine. If it doesn't mean that every patient will have all the symptoms. We are giving you the range of symptoms that patients come with. Some other symptoms include loss of smell. Loss of smell, sudden loss of smell or anosmia is a pathognomonic indicator of COVID. That means even if you don't, it is as serious response, an indicator as a RT-PCR test. So if a RT-PCR is diagnostic, getting a sudden loss of smell is almost pathognomonic. But the good thing about this sign is that if you have loss of smell, that means that you have a milder variety, so that likelihood that you will recover spontaneously, and it is a less infective variety. The other signs which include a more infective variety are diarrhea, vomiting, and we are seeing a lot of vomiting and diarrhea in children. This second strain, which is now in the second wave, it is affecting children a lot. Almost 8% of the affected population is children. In the last 3 days, I have known of several. I mean, all my pediatrician friends will vouch for it. The OPDs are overflowing till 12:30 at night. They are seeing patients, and it's a very, very difficult situation, especially since children are involved. And now we've had children with low oxygen saturations, also desaturating and needing hospitalization early.
Thank you, ma'am. So, on the same note, I would like to ask you that could you also throw some light on how COVID 19 symptoms are different from those of allergy and common cold?
Right. So allergy symptoms usually happen. Patients know that they have a history of allergy. So persistent allergic rhinitis, and when you wake up and sneeze every morning. So such patients have had symptoms over several years. And intermittent allergic rhinitis or seasonal rhinitis is when patients say every February, March, every September, October, I will get these symptoms. So these patients, usually the doctor would already have diagnosed them and given them some tablets and nasal sprays, and they know very well that इस season में problem होता है. You start the tablet, start the spray, they recover. Fever, sore throat, body aches are symptoms that never ever happen with allergic rhinitis. Coming to common cold, common, so a lot of people say कि नहीं viral तो सबको हो जाता है. So usually common cold or flu, influenza is a self-limiting disease. Within 5 days it usually subsides, and usually it is like someone in the family gets it and everybody else gets it. But this time we are seeing, because in the last 1 year most people have been wearing masks, and children have not been going to school, they've been not been getting exposed to other children, and people, even if they go to offices, they're wearing masks. So we find that the incidence of common cold, flu is also much less than usual. Of course, if it gets infected with a viral bacterial infection superadded, then your sore throat becomes severe and you develop signs of difficulty in swallowing or pain on swallowing. That is the time when you get a online consultation, or if you safer times you meet a doctor and get a oral antibiotic prescription. But paracetamol and decongestants, anti-allergics, cough syrups, steam, all of these things are something that patients can start on their own. So, COVID, in a time of a
Okay,
pandemic,
ma'am.
if somebody is developing a sore throat or cough or headache or body aches, then we don't say it is just a common cold. You should get a test done. And the more we test, the more numbers we identify, the more we isolate, and more we stop the spread. The problem is when patients, they will, even in my clinic yesterday, as just yesterday evening, there was a patient sitting in my waiting room without a mask. I said, Madam, where's your mask? It's in my finger, and she has fever for 7 days. So patients like this, I mean, after knowing very well what a severe pandemic we are in and what a dire crisis hospitals are, there are no beds found in any hospital. We are struggling to try to get the private hospitals to vacate the less sick patients so that the more sick patients can come in, and that is the Gurgaon administration is doing it. I'm sure every city administration is doing it, because we are trying to save lives. Patient with mild symptoms who can become all right at home, if they are occupying the bed, the patient who has oxygen saturation 60%, 70%, who's most likely to die if he or she doesn't get oxygen. So that is something that we need to optimize in the time of a pandemic. So that is not the time when you are casual about it, and we have to understand our social responsibility towards the same.
Yes, ma'am, definitely. It is a very scary time, and also patients are more into self-diagnosis these days, and they wouldn't believe the doctor at all when they're telling you that yes, you have COVID. They'll just brush it off as a common cold or any seasonal allergy. So I do get it, because in our colleges also we go to ENT clinics, and we had this patient who came in for a ear infection, and he wasn't wearing a mask. When we told him to wear a mask, he just got up and went away. He's like, I don't want to be here. So
Good. Please tell him, please
this-
don't be here, because we don't want to get infected. We are here to serve you, we are here to help you, but we also have to go back to our families, and we intend to stay alive through this pandemic. 750 doctors have died in the last 1 year out of COVID, and everybody who thinks that we don't need to wear a mask, these are the people who are responsible, directly responsible for all of our doctors dying. And it is a very scary situation, and the more serious people understand, the better it will be for all of us.
yes, ma'am, sure. I think the fear is just gone, because people are, I don't know, maybe they're tired of wearing masks and washing their hands continuously so many times a day, and they just do not fear the virus anymore. They're walking in groups, and
Pandemic fatigue. So this is what becomes. You start. I know I have met people who tell me, "डॉक्टर साहब मास्क क्यों पहना है? ये तो ऐसी कोई कोविड कोई चीज ही नहीं होती." So my answer to them is, ये भगवान का शुक्र मनाइए कि आपके घर में कोई मरा नहीं. 2 लाख परिवार ऐसे हैं हिंदुस्तान में जो पिछले 1 साल में अपने फैमिली मेंबर्स को खो चुके हैं, और अब वो अफसोस कर रहे हैं. और 750 डॉक्टर्स ऐसे हैं जो डेथ हो गई जिनकी, और ये सारे एक्टिव लोग थे, जो एक्टिव प्रोफेशनल्स थे, और देश को इनकी ज़रूरत थी, उनके परिवारों को इनकी ज़रूरत थी. तो और कुछ नहीं, तो उनकी रिस्पेक्ट में अगर मास्क पहन लेंगे तो कोई आफत आ नहीं जाएगी.
yes, ma'am, until and unless it, happens with people don't get it, because till then it's just names of some strangers who have died, and they do not feel that empathy towards them.
That is what, no, I mean, after
Okay,
some
ma'am.
time,
So moving,
statistic. Yes, tell me.
yes, ma'am. So even though people do not fear the virus, but they still fear that they will contract COVID from the vaccine itself. So what do you have to say about that?
See, unfortunately, there have been a lot of myths around the vaccine. Fair, I mean, initially, I would say they were justified also because a lot of patients, people, including myself, I used to think that especially certain vaccines had not been given the trial three, phase three, and they had been given the permission preemptively, and a lot of people suspected that it was pharmacological reasons and financial reasons for corporates to make money than actually it being safe. But now, after 3 months, 16th of January, India started vaccination, and now we've been doing 3 crore vaccination a month. So it's almost 10 crore people have got the vaccine, and many of us have got two vaccination. I can assure you that the vaccination is very safe. In India, till now, we've had about 25 cases reported of death due to, I mean, after vaccination, not due to vaccination, because not even one time have they said that this death is due to the vaccination. But to give you a perspective of the safety of the vaccine, there is a paper in a very good journal which came out about 2 days back that they have measured that about out of the 10 crore people who have taken the vaccine in US, 5,476 of them contracted COVID despite having two doses of the vaccine, but only 76 of them died. So out of 10 crore people, in the end, it was about 76 people who died. So that is about 76 out of 100 million. So that is
Yes.
safety of about one in a million. That is like it is huge because if as a lay person, if you see, if one person gets a vaccine, doesn't take the vaccine, if it is an unvaccinated person, has a 3% chance of reaching the ICU and a 1% chance of dying from the disease. 97% chance that you will remain all right at home and recover. So, if it is a 1 in 100 chance of dying from COVID vaccine infection, the vaccination reduces that chance by several thousands. So, it makes that chance 1 in a million. So, your vaccination is the best thing that you have right now in your armamentarium other than wearing a mask covering your face and mouth. I urge everyone to just keep their inhibitions aside. Please don't use WhatsApp Gyan. Don't see those random videos that people, uncles and aunties keep sending throughout the day. This is science. Believe in it. It is your best chance to save you. I know there are a lot of people say, "Hey, 35 doctors from one hospital contracted the disease." Yes, they came positive, but fortunately, none of them died. That itself is such a saving grace. Only two of
Yes.
them needed to be hospitalized. So that shows
Yes,
that
ma'am.
the vaccine is not only safe, it is useful. And now that the government of India has finally agreed, for the last 2 weeks, the Indian Medical Association has been urging the government to start vaccination for all adults above the age of 18. The government has finally announced yesterday that from 1st of May, everybody will be allowed to be vaccinated from 18. So I urge everyone the moment it starts. And I also assure you that I have used a private facility and a government facility. The systems are very smooth, and I must give credit to the entire ministry that's doing this, from the center to the state to down to the PHC and the nursing staff. Everybody, the data operators, are doing a fabulous job. Even while you sit when you're that 30 minutes when you wait for the vaccine, you get your SMS saying that you have got your first shot or you've got your second shot. The system is very good, and I urge everybody to just take it because that is the one thing that can save you.
Yes, I believe that people should believe in the promising figures that the vaccinations are showing, rather than believing the WhatsApp university. And our healthcare workers are working day and night. And when we got vaccinated, they take care of us so well. For the 30 minutes, they'll come and ask you again and again, are you facing any symptoms? Are you feeling dizzy? So yes, they're doing their bit like very confidently and wholeheartedly. They're working towards a betterment. So I feel that people should acknowledge that and get vaccinated.
But also, just to give you a small thing, that the only people who should not get vaccinated are those with a history of severe anaphylaxis or severe drug reaction. So a lot of, since I'm an allergy specialist, I've been getting calls from random patients across the country because my number is on the web, and asking whether it is safe for them to take the vaccination or not. I'm using this opportunity to tell everybody, if you have a history of severe allergy to a drug, any drug, suppose you've taken a drug and your face is swollen up or you develop respiratory distress, then it's possible that that vaccine may not be safe for you. I have my very dear friend, her mother had a severe penicillin allergy. I told her better not to take it right now, but their family decided to take it anyway, and she landed in the ICU. So fortunately, she's fine and safe now, but it could have gone anyway. So if anybody has a history of severe drug allergy or severe food allergy, then it is better to ask the hospital to give you a test dose if it is possible. I don't know whether it is feasible or not, because the government setup I asked, they said they don't have the facility. But maybe they can go to a private hospital and ask the emergency doctor to give them a test dose and see if that works, and they don't have any response, any adverse effect, only then they should take the vaccination. That is the only subset which should take COVID vaccination with great caution, because neither the government of India nor the manufacturers are taking any responsibility for any adverse effects that happen of the vaccine. So the decision is also yours, and the side effects also you will only be facing. So anybody with a severe drug allergy, you please be very careful when you take the patient.
And I feel, ma'am, that here the patient also has to, give the proper history, the proper allergy history and drug history before taking the vaccination. Like like if they want to take vaccination, they wouldn't tell that I have had this allergy before just because they want to get it. So I think even the patient should be very careful while giving it the
Definitely.
history.
After all, their life on the line, no? If the doctor or the nurse is just going to put the injection, it is your life on the line, and we don't want to lose it. So you just be careful. We have
Yes.
to weigh the risks of taking the vaccine versus the risks of not taking the vaccine, and it has to be decided for each and every person individually.
Yes, ma'am. Okay, so ma'am, also another myth which is going around is that if one has had COVID before, they do not need to get vaccinated because they have already developed an immunity to it.
Yeah, so like that the number of strains that are coming, the mutations that are happening in India now. We have the B1617, the mutation that has happened, and it is a highly infective one, which is also bypassing the previous antibodies. That means that it's, of course, no one can tell with COVID. It's such a new disease that we've had so many strains. Everything was becoming better. Suddenly, that UK strain and the South African and the Brazilian strain came, and they had to lock down. So now nobody had anticipated in India. They had even stopped making all the antiviral drugs. I know that in February, a couple of pharma companies gave us Faviflu and all these Favipiravir, saying कि मैडम किसी को चाहिए होगा तो दे दीजिएगा. And for 3 months nobody used it. It was just lying. The samples were lying, and suddenly the spurt came out of nowhere. And in 2 weeks' time, we've reached a stage of dire crisis. And all of that medicine I was able in within one day I had to send it out to 4 or 5 people who got positive because it was of a shortage. Now the companies have started manufacturing, and they've assured me that within the next 48 hours you will have it on the shelves again. So I mean, nobody can say how it's going to be. So why would you want to take a chance? You when
Exactly.
you I mean, you could check your antibodies, but I would think that when you are entitled to, just take the vaccination, and don't act like you're a superhero, because you may get a different strain. And obviously if you've got it once, that means your immunity is not fit enough to handle the infection. And then now that you've recovered, bless your stars that you didn't reach ICU or the crematorium. So look after yourself more. I would think it is an opportunity for you to be more cautious, not less cautious.
Yes, ma'am. Sure. Okay, ma'am. Another myth which is holding people back from getting vaccination is that the side effects after the second jab of the vaccine are comparatively more severe than the side effects which they faced after the first dose. Is that true?
You got 2 doses.
Ma'am, I only got one dose.
So after my first dose, I had pain in my arm and I had fever for 2 days. And I rested for 3 days flat. I rested and I took paracetamol and I just waited for it to go away 3 days. But my arm was heavy and it had pain. My second dose, I had heaviness. I did not have fever. I took one crocin that day, and that is, paracetamol that day, and that is it. Next day morning, I went and played badminton. So it will be a variation for every person. My parents fortunately got 2 doses each, and neither of them had any symptoms whatsoever. There are a lot of elderly people who are
Mm-hmm.
taking the vaccine saying, "हमें तो कुछ हुआ ही नहीं." So that is an individual variation how your body responds to it. So there are no rules. It'll be more in for Covishield or more for Covaxin or more after the first dose, more after the second dose. You have to take it, just take it. It is your safety kavach. Take it and move on.
Yes, ma'am. And also, people believe that if you're not, having fever or not experiencing muscle ache or anything, then the vaccine is not working. I don't know why people say that.
No, so see, the thing is that everybody, now we've had people become experts in COVID, right? No, non-medical people will be asked, telling you about tocilizumab and remdesivir and Faviflu and side effects and indications of ivermectin and chloroquine, and you laugh because I mean, as an ENT surgeon with 20 years of experience, I don't think I'm an expert in COVID treatment, and I don't manage patients. Whenever somebody in my family also comes positive, I refer them to a COVID physician, somebody who is doing their job. So I honestly believe that we should leave it to the expert. जिसका काम उसी को साजे. Like if it is something in ENT or allergy, I would be the fine. I mean, I expect I would have knowledgeable information and give you the right advice. But for every other thing on the planet, I will not pretend that I'm an expert.
Yes, ma'am, because it's an ever learning process. Medicine, it just keeps on evolving every day. So
And
you
you know,
cannot.
like that beautiful saying that don't confuse your 10 minute of Google search with my medical degree.
Yes, ma'am, definitely.
Very apt. So yeah, that's that's my last word on that subject.
Yes, ma'am, there's so many doctors who just hold their heads like, please do not quote Google to us. Please do not. Just tell us your
I'm
symptoms
very
and we'll
happy
give
to
you.
quote Google. No, no. See, it is. I'm very happy. So I practice in a cyber city, right? I am in Gurgaon. It's a millennium city. So everybody here is a techie. So I encourage people. Everything I write my diagnosis in capitals, and I tell them, please go read up about it. So we also, as doctors, have to open our minds to technology and not be afraid of answering questions. So most of the time, patients are, yes, some of them are a little pompous and they think that they know it better just because they can pronounce it, but by and large patients are they're well informed, and I would prefer that when we tell them that you please read up and you come back, we are not, then they feel that we are open to questions instead of us feeling that every question is a there someone is questioning our authority. Doctors also have to change their stance a lot. Technology is available on the click of a button. Why must you not give your patients the benefit of the doubt? Tell them, please read up and ask me anything you want to know, anything you want to clarify, because Google actually scares patients. It starts and everything ends with cancer and death. So by the time the patient comes to you, they're very psyched out. They're very scared. And I tell them, you know, this is not cancer. Don't worry, because then you can see the relief on people's faces. Doctors also have to evolve. No, we have to change the way we practice, and definitely we should encourage people to read up as much as possible.
Yes, it just becomes a little bit imposing when they just come with the symptoms and they're like, just please prescribe this drug to us, okay? We have these symptoms and we know we have this.
Then you should tell them, if you have, that's the pharmacy, just go and get the drugs. Why do you want my prescription? Because I will use my intelligence and I will have to examine you and I will have to decide whether these are the things that you have and this is what you need. But that's a byproduct of dealing with patients. But I
I'm sure. Okay, ma'am. So another question which is being asked by everyone these days is that can the current vaccines provide protection from these new mutant strains which are coming up?
no one can say.
Okay.
No one can
Because
say.
there were some articles where it said that they can provide a little bit of protection, not like proper protection, but yes, they will provide you a little bit of immunity from the
You
new
have to
strains.
understand these vaccines were developed before these mutants arrived. So
Yes, ma'am.
obviously they were targeting a particular set of antigens that were existing at that time. Now this virus is mutating and that's its job, but the science has to keep up with it. I'm sure that the scientists will be working overtime to figure out these. They're doing lots and lots of research, and almost I was reading last night about the various kinds of strains, and there's sequencing of more than 20,000 per day is happening. So they are also working at a war footing, and as lay public, I think it's our job to leave this to the experts instead of trying to be the final word on something that we have absolutely no clue about.
Correct, ma'am. Very nice. So moving on. So suppose a person is fully vaccinated and then they come in contact with someone who has COVID-19. So what should be the next step? Should they isolate themselves or should they just carry
I
on with their daily life?
I would definitely hope that they are both wearing their masks properly. That is the first question that I will ask anybody who got exposed. Were you wearing the mask, covering your nose and mouth or not? And how long did you stay with that person? And where did you remove your mask to have a cup of tea? Because these are things that show that you got exposed. And I think it is best to at least stay at home for isolate for 5 days. Wait to see if you have any symptoms. If you don't have symptoms, that means your immunity has worked. And if you don't have symptoms, then it's most likely that you're not also a carrier. So that would be a better thing to do.
So should they get tested, ma'am?
No, not unless you have symptoms. I would suggest that you just isolate. Why do you want to waste a RT-PCR kit when you most likely if you're not even showing symptoms, then that means when you do the test early, it will come negative regardless. So then you will go around thinking that मेरे को तो हुआ ही नहीं. So you should wait for 5 days, see if you develop symptoms. If you develop symptoms, then you get the test done.
Okay, ma'am.
We
Okay.
all have to
So
understand we are 7 billion of us in the on the world, and we all are one unit. And if you are utilizing something that the another person needs, you're depriving someone who needs it a lot more than you. So use everything judiciously. I will say the same thing for beds, because I know we are struggling here in Gurgaon to get beds for people who are on 60% oxygen, 70% oxygen. There's a child in an ambulance for 88% oxygen. And inside the hospital, I know there are patients who are on 95% saturation and they're spontaneously. So they're the people who must leave. I would urge the doctors in all the corporate hospitals, please discharge those so that the next set of people who could use that oxygen better, and we could save a lot more lives. So that is my fervent request to everybody. If you're fine and you just are positive, you don't please go and occupy a bed. Just because you have the contacts or political muscle to get a bed, please don't go and occupy a bed, because that bed was not available, somebody may die.
yes, ma'am. Very true. Okay, ma'am. So, lastly, what is your advice to people who feel that they have become immune to the virus after they have received the vaccine and they will not follow the necessary precautions after that?
See, from day one, the scientists have been saying that even if you get vaccinated, you have to wear a mask at all times. Not one article, not one place they said that if you have been vaccinated and 20 days later you can roam around without a mask, because you may still be a carrier. You may still take it from someone and start shedding and infect other people. And considering this current strain is infecting children, I think it's all the more very risky. People who got vaccinated may pass that infection to the children. So just wear a mask. How much, I mean, why, how much is the mask troubling anybody? I've got so used to it. I've got matching masks for almost, I've got 7 to 8 different kinds, colors of masks, so that I feel like it's a fashion accessory. And you just have to make peace with what it is, and you have to do what you have to do. And when I am seeing patients,
Yes.
I try to wear a double mask. And if I am these days, because of this new strain, I've started wearing an N95 under my cloth mask. So these are things that we have to
Yeah.
adapt to the changing times. So anyone who change is the only constant, and this virus is teaching us that you have to change. You can't say नहीं मैं तो मास्क नहीं पहनूंगा. भाई तुम मरोगे, तुम किसी तुम्हारी वजह से तुम्हारे बच्चों को भी कुछ हो जाएगा. So yeah, things. I mean, this is unwarranted, and I face a lot of people like that, and I go about in various parts of society. So there are two. I mean, I also feel there are two kinds of worlds. One is my condominium, where if somebody has a mask under the nose, other people shout at him and say, "What are you doing? You are risking us." And when you get out and you step out into the on the roads of Gurgaon, you see somebody's mask is on the ear, somebody's mask is on the chin, somebody's mask is on the barely anybody who has a mask here. So there are definitely two extreme parts of India within this country and within our cities. And there are also all sorts of people. Some believe that they will get infected if they step out. Some believe that the COVID doesn't exist. And we are all on the same, different people on the same spectrum. That is the spectrum, and we're all different shades of places here. But I think this is a
Yes,
time
ma'am. I think it's very
stay at home. This is dangerous time. Children are at risk, so that makes it all the more important that now people should impose a self-imposed lockdown. I don't want the government to announce a lockdown, because then the poor people start dying of starvation instead of COVID. So definitely that, because then what happens is all our focus moves from providing oxygen to providing food, and more people die of the lockdown than COVID. So definitely that is something that I would urge the governments not to do right now. I think it's important that all of us stay at home, especially the children. No interaction with others. They can go downstairs, run, cycle, but it has to be a solitary activity. No mingling with other children, so that children remain safe. That is a very important thing right now.
Okay, ma'am. I also believe that it's very hard to shake off the belief system in our country because people have a certain mindset and they wouldn't listen to us, like our like medical students, doctors, and other paramedical staff. They just feel that no, what we believe is right, and we are not gonna catch it because because we have a very strong immune system and we have our religious beliefs and everything. I don't know when people will understand that people
No,
are
but
dying daily.
don't you remember that? All remember that person who COVID has taught us some really funny things, right? All the people who said if you put cow dung on your mobile and cow dung on your body, that gentleman had COVID. Then there was a person who said that Ayurveda say you don't have, that gentleman died of COVID. Then there were all sorts of random things. So even there were videos from US that there's a young person who said that I didn't believe in COVID and now I'm dying, and he was a video from the hospital that went viral. So, I mean, you can play with your lives, but I would strongly urge you not to.
Yes,
The thing for us is that all of us come out of this alive. It's very difficult, and you must understand that healthcare workers and frontline workers, the people who are supplying food, and policemen and sanitation workers, they are putting their lives on risk, not for the not because they want to be heroes, but because that is the nature of their job. I mean, none of us had thought that practicing medicine would become a hazard to our lives. It's more dangerous than going to war. We have lost more doctors than we lost soldiers in the Kargil war, and the country must treat it as such. It is a war with a pandemic and with COVID, and the doctors are standing there between you and death. So you might as well respect them and listen to them and wear your mask.
Yes, ma'am. It's like really funny that people would post stories on their Instagram and Twitter about how they should go about this pandemic, wear mask and follow the precautions, but they themselves won't do that in their real life. They will just go around with the mask hanging or not wearing. It's like here or it's below the chin, and then when you ask them why you're not wearing, they're like, no, it's okay, it doesn't happen. We are at a 6 feet distance from the other person, so it won't happen to us. But nowadays, I think it's like very transmissible.
Yes, it is. This one is now they are saying that it is not only droplet borne, it is now airborne. The news
Airborne, yeah, ma'am.
spreading about it. So that makes it like really, really, really scary. Because
Yes,
earlier at least it was 6 feet away and droplets. If you're wearing a mask, you're safe. Now it means that even if you're just breathing, you may take it. And so these days I've taken to wearing two masks.
yes, ma'am. I see a lot of people, especially in colleges and schools, who go wearing 2 or 3 masks. People have started wearing 3 masks also. And I'm like, how are you even breathing?
It's
Okay,
whatever,
ma'am.
you can stay safe.
Yes, ma'am. Okay, thank you so much, ma'am. And I'm very sure that you have clearly dissipated the misconceptions surrounding the COVID-19 pandemic and its vaccines. And humanity will always be grateful to doctors like you who relentlessly wage a war against COVID. And our thanks and best wishes to you, ma'am. Thank you so much for joining us today.
Thanks, bye.
Bye, ma'am.